Good afternoon, dear students. This is the number 4 lecture about the clinical nutrition of dog and cat. We will continue the dietary treatment of diseases, and in this frame we will continue the diseases related to some organ. But before that, in this way, you have to be oriented that in the fields of clinical nutrition, we are in the number 3, dietary management of clinical diseases, and we will start with the dietetics of liver diseases of dog and cat. Some aspects has been mentioned before, but this will summarize and enlarge your knowledge. In this picture you can see that how many possible damaging cause etiology can hurt the liver. You see from left to right around the clock, around the liver clock, hepatitis virus, abnormalities in metabolism, another viral infections, drugs and poisons and xenobiotics, and all of those may result in hepatitis, cirrhosis, and sometimes or many times in chronic cases liver cancer. The most important etiology of liver diseases are as follows. Birth defect called congenital portosystemic shunt, which is a failure of the anatomy of the important vessels in the liver. Dogs can have acquired shunts which develop when there is a blood pressure backup in the liver due to hypertension or due to a cirrhosis of many other causes. Viral canine hepatitis, which can cause inflammation and scarring, and leptospirosis through contaminated water sources it's possible, and this is a zoonosis, and every sorts of toxins which can go through the liver. Here in this slide you can see how we can make the clinical investigation of the liver by palpation, touching, by X-ray. You can see of the upper right picture the liver, the intestines, the kidney, and the stomach. And the lower picture you can see the ultrasound picture of the liver. To overview the most important symptoms of the liver diseases before going into the dietary details, you have to see the jaundice, the hepatic encephalopathy, gastrointestinal signs, and ascites. Jaundice is a yellowish tinge to the skin, most often noticed in eyes, gums, and ears. Why? Because the liver is responsible for excreting bilirubin, which is a byproduct of the red blood cell breakdown, the hemoglobin residue. The hepatic encephalopathy is a collection of neurologic signs like seizures, disorientation, depression, head pressing, blindness, or personality changes. it is interesting as a to improve your memory that it is typical in horse, for example, leaning to the wall with the head. You have also gastrointestinal signs, decreased appetite, with vomiting and or diarrhea, weight loss, and increased drinking and urination, polyuria and polydipsia. By this way, you have to make a differential diagnosis with diabetes and some hormonal disturbances, and also the color of the feces may change. And we have many times ascites, a fluid retention in the abdomen. To reinforce our diagnosis, we have to make laboratory investigation, and the liver function test consists of total protein, albumin globulin ratio, alanine aminotransferase enzyme, alkaline phosphatase enzyme, total and direct bilirubin and indirect bilirubin. And you see that inside the normal total protein range, we have a decreased albumin and increased globulin concentration. The alanine aminotransferase concentration increases because of the integrity of the hepatocytes is weak, and therefore the enzyme can get out in the blood, and the bilirubin also. The dietary treatment summarizing to the liver diseases are following. Highly digestible carbohydrate should be the basic of the feed mixture. We have to use ammonia traps, for example, lactulose or prebiotics. What are these ammonia traps? Ammonia traps are substances and compound which in the lumen of the intestine can bind the ammonia, and by this way prevent from absorption, prevent from transformation in the liver into urea, which would be a extra loading in work for the liver and a direct effect of a toxin. And this fixed ammonia or trapped ammonia will be eliminated by the feces. We will mention it in the relation of the kidney problems. High biological value protein should be given, but in an extremely restricted amount to avoid the dissemination of the super floating of the extra protein and the production of free amino group and extra detoxification work for the liver. Therefore, we have to set the protein value between 13 to 16% of the dry matter in case of the dogs, and 24-26% of the dry matter in case of the cats. The requirement towards the vitamin B group and vitamin K is increased, so we have to give a supplementation, and we can give high energy in form of carbohydrate to meet energy needs and spare protein. The Bedlington Terrier's copper storage syndrome has been shortly mentioned. Here I will overview and after supplemented with the treatment. This is analogous to human Wilson disease. The cause can be seen in the lecture 1, lack of metallothionein clearing enzyme. The prevention is a feeding of a low copper diet and supplement it with copper binding compounds like sulfur or sodium sulfate. The treatment slide summarize the details. Prohibited diets high in copper are the liver itself, mushroom and cacao. We can add chelating agents like penicillamine with B6 and triantine, and it can bind the copper, the free copper in the blood, and eliminate it by the kidneys. The zinc in form of zinc acetate or zinc sulfate can compete a little bit with the copper. And the tetrathiomolybdate and the sulfur powder may bind the copper inside the intestinal tract in the lumen and prevent it from absorption and will it eliminate by the feces. And then in last cases, the liver transplantation is the solution. Finished the liver, we will move to the next organ, and these are the kidneys. In the picture, you can see a rubber jaw and a mouth and teeth of dog with uremia. Once it was shown, this picture showing the all-meat syndrome, both may be at the background, but here maybe the uremia was the leading cause. The first kidney problem to speak about is the chronic kidney disease, or CKD. Previously it was called chronic renal failure, CRF, and you will find in the previous textbook in this under this name. But this is not only a play with the word, because the chronic kidney disease has stages. If you check in my textbook or in the Merck veterinary manual, you can find 4 stages, 4 categories of the chronic kidney disease according to the blood parameters, and therefore it is a much more delicate approach than the previous one. On this first slide, I summarize the meaning, the message of this disease. Aim of the therapy, of the dietary therapy is, and this is the key of all the following section: low protein diet, replace water soluble vitamins and calcium, which was eliminated, and prevent accumulation of phosphate. So these 3 basic columns are at the background. We have to see the secondary renal hyperparathyroidism as a chronic kidney disease end phase. In mandible bone causing rubber jaw, which is not only in case of mammals, but interestingly enough, you can see also in the iguana. Iguana is very sensitive, very prone to skeleton problems of calcium and phosphate metabolism. After this summarizing first slide, we will go into the details, and after this summarizing slide, we can go into the details of the pathomechanism of renal hyperparathyroidism. This is a hyperparathormone production, and why? Because of the kidneys, and the kidneys feel as a feedback the increased serum phosphate concentration, because the renal tubuli are not able to filtrate the serum frequency here, and by this way the serum phosphate will inhibit the 1-alpha hydroxylase enzyme, which is an enzyme of the kidney tissue to activate the vitamin D. The first step of the vitamin D3 activation occurs in the liver, and the product is hydroxy 25 cholecalciferol. But the really active vitamin D3 is the 1,25 dihydrocholecalciferol, and this enzyme would be active from the kidney tissue, but the high serum phosphate will inhibit it. Low active vitamin D3 may decrease the calcium absorption. Consequently, the serum absorption will decrease, and once more the serum phosphate will increase. By this way, you will have a highly increased parathormone secretion by the parathyroid gland. The high parathormone will solve the bone calcium together with the acidose present, because the kidneys are not able to eliminate the ammonia NH3 in form ammonium cation. This is acidose, and acidose itself will cause osteodystrophy. Back to the PTH, increased PTH level. This is a uremia causing toxin, which will damage the bone marrow, causing anemia, and this anemia is facilitated by the lack of the normally kidney derived erythropoietin hormone. One more, that this serum calcium and high serum phosphate may cause at the same time retention of the calcium, once more decreasing the serum calcium level. The partial fall of hair at Pulley Beach is no pathogenic sign. This is a relative lack of protein. During the lactation, practically each beach producing a high amount of concentrated milk and will get into a relative lack of protein and can have a fall of hair. What is different in case of the Pulley Beach, that this fall of hair is partial only in the first part of the body. We can guess that maybe that the hind part should have been protected by the remaining of the hair. The second kidney disease is the glomerular nephritis. This is a problem which cause a persistent proteinuria with a consequent hypoalbuminemia in the blood. The oncotic pressure of the blood will drop, and by this way plasma can enter into the abdominal cavity, this is ascites, into the thorax, this is a hydrothorax, and even subcutaneous, will causing subcutaneous edema. At the background will develop a hypertension because of the resistance of all these tissues. These accumulation of the plasma can be prevented because this plasma is fixed by sodium. If you prevent the accumulation of sodium and parallel to that of the water, we can reduce the hypertension, and we have to increase serum albumin level. At the same time, with the feeding, we have to maintain the blood urea level within the normal range, which is different in case of dog and cat. In case of dog, this is 3 to 5 millimole per liter, and in case of cat, 5 to 8 millimole per liter. These numbers reflect that the cat metabolism is a carnivorous metabolism and the dog is a little bit omnivorous. What does it mean that low protein? Low protein means even a little bit lower than previously mentioned, 2 gram per kilogram live weight for the dogs and 3.5 gram per kilogram live weight for the cats, of really high biological value. Of course that the tasteless, these proteins has proteinless feed mixtures are not preferred by the dog and especially by the cat, so you have to improve the taste, for example by using the so-called digest is with enzyme treated viscera and intestinal tract of slaughterhouse byproduct from poultry. This is the low protein, and what is crucial, we have to reduce the sodium. The maximum can be 0.3% sodium in the dry matter. Remember that for a normal commercial pet food we can have even as a taste improving factor extra sodium chloride, so for that. After the kidneys we will move to the congestive heart failure. According to your current veterinary textbook, the Professor Wörös inner diseases give at least 15 causes of the congestive heart failure. I like to mention only one, which is related to the feeding and our first lecture, and this is the dilated cardiomyopathy. We have mentioned that the carnitine deficiency in brachycephal and maybe other dogs may cause heart failure. Okay, this is not the field of the dietetics. We have to see the main symptoms and the dietary treatment. You have pulmonary edema and consequently difficult breathing, and of course exercise intolerance, and also related to MVD, mitral valve disease. You can see in this congestive heart failure severe graded ascites. But in the pathogenesis, you have to keep in mind the following. There is a low blood pressure at the beginning, which will cause a poor renal perfusion, which in turn may activate the renin angiotensin aldosterone system at the outer part of the arteria renalis, which receive as a feedback the blood pressure and try to increase the blood pressure. But this is a circulus vicious circle, and the consequence is a retention of sodium and, together with the sodium, water in many tissues, which will give a further loading to the heart. The clinical findings, besides the previous pictures, like pulmonary edema, congestion, edema, and ascites and hydrothorax. The dietary treatment and control of the chronic heart failure is a feed mixture of low in sodium, no more than 0.25% of the dry matter, but in this case will be less palatable. You have to warm it, you have to give a little bit of spicy, like garlic, some tuna and sardine, and distribute the daily feed ration into several small meals. Feeds to avoid: the salty feeds rich in salt, like the cheese, the bread. Be careful, because the cereals are low in sodium, but after the preparation of the bread they have added a lot of sodium. All the processed meat and meat product, the cereals, like the porridge, which is which undergone to technological processes, carrot from your soup, heart, liver and kidney, because of the residue of the blood may have a high sodium content. And the whole egg, especially the egg white, and be careful, the pet treats in many time are high in sodium. Feed to choose which are low in salt are the lean meat of beef, rabbit, chicken, and horse. The yolk of the egg is good, and the oatmeal and the rice and the pasta, and pasta is the best in case of homemade diet. You can help by using additives, L-carnitine in case of the dog and taurine in case of the cat, to improve the capacity of the heart muscle. Now we arrived to the last section of the dietary management of clinical diseases, namely the systematic diseases of the metabolism, of the endocrine system, etc. Urolithiasis, diabetes, hyperlipidemia, and puerperal eclampsy. In this lecture, we will see the urolithiasis in case of cat and a dog, and we will continue the other during the next lecture. And this is the feline lower urinary tract disease, FLUTD. Previously, it was only feline urinary syndrome, FUS. And here you can see the struvite crystals, electromicroscopic picture from the Vienna Veterinary University. In this slide, you can see the picture of the most important, most frequently found uroliths. You can see magnesium ammonium phosphate or struvite crystals. So these two are the most important, the calcium oxalate left in the middle row, and struvite magnesium ammonium phosphate. But you can see also gypsum. And to see that how to manage the feline lower urinary tract disease, the FLUTD, the previous feline urinary syndrome, the mostly common urolith or urethral plug is the struvite crystal, the magnesium ammonium phosphate. Therefore, if we are feeding diets which results in acidic urine pH, and if we enhance the urine volume, and if we reduce the magnesium intake, these three the triple effort will prevent the struvite crystal. How can you make acidic urine? By adding D-L-methionine in tablet in an ambulatory situation, or ammonium chloride in pet food or special veterinary diet. The ammonium chloride has a ugly smell, therefore in a small amount in ambulatory clinics you cannot use it, but the D-L-methionine tablets are good. Adding sodium chloride, common salt, what is the consideration to that? It is not bad to stimulate the drinking and enhance urine volume, but be careful that no kidney disease at the background. If there is a cystitis, you have to at the same time apply sulfonamide or antibiotic treatment to the animals. Okay, what about the alkaline urine? Alkaline urine is not typical for cat and dog, but the vomiting may cause alkaline state by losing a lot of acid, or the postprandial alkaline wave when all the gastric acid is fixed into the feed, and the hyperventilation by losing a lot of CO2. For the diagnosis that is there a danger of formation of stones, urinary stones in alkaline urine, we can use the relative supersaturation, RSS, which is 13 urine parameters plus the volume of the excreted urine. And if you see that there is a danger of urinary stone formation, you can make a control or treatment by adding mannitol to stimulate water intake. So this is another approach when you don't want to change the pH of the urine, but you want to enhance the volume and decrease the danger of stone formation. The next is the canine urolithiasis, which is not so common than in case of the cat. Only 2% of the population is affected by canine urolithiasis. The order of incidence is a little bit different. The first is the same, the struvite crystals are the first. But the oxalate is not on the second, but on the third place. And the second in incidence are the cysteine crystals, what you can see the picture at your right. This is from the cysteine double amino acid. But you can have urate and silicate crystals, and the danger of infection, especially in females in beaches, are very high. So in case of canine urolithiasis, at the same time of the dietary treatment, you have to start with the sulfonamide or antibiotic treatment. And to finish with, there is a possibility to calculate or to predict the pH of the urine if you know the calcium, magnesium, and sodium and potassium cation level and phosphate chloride level in the feed mixture or in the pet food. This is the cation anion ratio, which can be calculated according to this equation. And the pH equal to 6.5 plus 0.002 cation anion ratio. The equation is valid if only the feed is balanced in amino acids. Not too much sulfur-containing amino acid can be present, because in this case it is more acidic. Here we will finish the lecture 4 and we will move to the lecture 5 to the other systematic diseases, diabetes mellitus, hyperlipidemia, and puerperal eclampsy. Thank you very much for your attention. And thank you very much for your attention. In the next time we will have 2 lectures and we will finish the dietary treatment of diseases, and we will move to the special dietary situations like heavy work and cancer patient.